Hello everyone, I'm going to go over your final assignment, your final written paper that you're going to be doing. It's due the last day of class, right before finals start. So that Friday this needs to be completed. I will put a Dropbox folder on D2L for you to put your paper. If you get it done before the end of the semester, that's great too. So essentially what you're going to do is go visit a treatment center, one that treats addictions of one kind or another. It doesn't have to be simply drugs and alcohol. There are treatment centers that also treat eating disorders. There are some treatment centers that treat gambling disorders and so on. They're not real common in this area, but they certainly are available. You don't have to visit a treatment center in this area. If there's something near your own hometown, that's just fine. You can go to that one. But you do have to visit an actual treatment center for addiction, and not any substitutes of any sort, okay? So let's go through these questions a little bit. I'll see if I can provide you with some clarification. These papers that you're going to write should be APA style, and inch margins all the way around, 12-point font and all of that. And I never set a minimum number of pages. I'm more interested in content. But on the other hand, if you turn in a one-page finished paper and looking at all these questions, that probably wouldn't fare too well. Okay, so let's go through these questions. Number one, identify the program you visited, describe it, and the population that they serve. So in other words, the name of the place, where it's located. I would suggest to you that you ask them if they have a pamphlet or something about their program, because that'll tell you a little bit more, give you some details that you might not otherwise get. Be sure and identify who you spoke to and what their position is at that place. When you call this treatment center, be sure and tell them that this is a class assignment that you have to do for your substance abuse class. Most treatment centers will know that we've done this for over 20 years now, and will understand what it is. Please go in groups. Please don't go one at a time to places like this, because as you can imagine, it gets to be quite a drain on them if they've got to do 6, 7, 8 separate interviews of the same question. So if you know somebody in our class, please connect with them and go in groups if at all possible. The second question, how do they define addiction and dependency? You'll probably get a pretty common answer no matter which place that you go, but let's see what they have to say about it. And in terms of assessing or evaluating the problem, it's a basic question of how they do that and whether or not they have formal standardized instruments, which pretty much everybody does today. Find out what those instruments are. Some places have these, I can't remember if it's 6 or 8 dimensions that they measure, one at a time, and there are other kinds of tools available too. So find out which ones they use and see if you can find out why they happen to prefer that particular evaluation tool. Do they assess client strengths and weaknesses? So this is kind of a social work thing. Because if you're going to change a problem in your life, you have to have some kind of foundation to build on. And that's why we take a look at client strengths. I think most places will tell you that they do indeed assess that, but find out how they do it. It might be assignments, it might be just their perceptions, of a client. There may be a formal written exercise of some sort, but yeah, let's find out how they do that too, okay? The criteria for admission. How are decisions regarding level of care made? These days, most people coming to treatment have probably already been assessed, like Rule 25, order from the courts or something like that. So the vast majority of people who are entering treatment have already pretty well been identified as having some kind of addiction problem. But there are people who perhaps have other disorders or problems that take priority and prevents them from really participating fully in that particular treatment process. So they may perhaps refer those people to some other type of program. I've even seen where they suggest a different unit in the own treatment center, right? They might be there in a drug and alcohol unit, but somebody suggests maybe they should go to the gambling unit first and then back to that. So there's different ways to do that. What do they do with cases that aren't accepted? And again, that's probably not real common, but we want to see where they refer, what the process is. And listen, pretty much every place that you visit is going to have that basic answer, which is good. We want clients to go door to door. Family involvement in assessment and treatment, two different questions. So when we first gather information from a patient, that's all self-reporting, right? Now, many treatment centers ask the patient for releases of information so they can talk to family members, spouses and that kind of thing. And we call that collateral information as part of the assessment. And it's always wise to get that, right? And then as far as treatment involvement, in the old days we had families there 3 to 5 days straight. Now it's pretty much a once a week thing. It could be just once within a month. Everybody's a little bit different on that. So find out, not just how often, but how they're involved. What is it they're having them do, and what's the goal, and what's the point, and that sort of thing. How do they handle grievances? It's very possible when you walk through this center that you will see something on the wall about patients' rights. If they give you permission, you might take a photo of that so you can, go back and look at the details later. But typically the grievance procedure is listed on that document. And everybody's got some kind of process, and they're pretty much required to do that too. So find out what it is for that particular treatment center. What do you believe about addiction, the philosophical underpinnings? Probably most of these places are going to talk to you about the disease concept again, or medical model or something like that. They don't always necessarily understand philosophical underpinnings, what you mean by that, but that's okay. Let them have their own interpretation of it and keep track of that and everything. But that's, the disease model is mostly what you're going to hear about that. The components of the program. So treatment is broken up into separate individual components. That means things like lecture, group counseling, individual counseling, maybe spiritual advising, there might be recreation. There's all kinds of things. All of those pieces are meant to be put together for the actual treatment of any individual person. So find out what they do and find out a little bit about what it is and everything. Do they individualize treatment? Well, listen, all treatment centers are required to do that. And so everybody's going to say yes. But ask a little bit about how they do that. Again, it's like, do you use any kind of instrument or written assignment or whatever it may be? Let them, ask the question, how do you do that? But let them answer in the way that they're going to answer. The next thing, I kind of wish I would change this question, and I'm going to, but cultural diversity. So I did have in mind when I first wrote that, people of different race and cultures, and how the approach might be different. And I'm happy to say that you will find treatment centers that have separate components for people that might be of a minority race or culture or something like that. And I think that's absolutely great. But, there's also the issue of men and women. And I think you'll find that most treatment centers have men on one end and women on the other. Who knows why that is? And age is an issue too. What about kids? Young kids, teenagers. Do they have separate units for them? Do they have a separate component of some sort for them? Or do they mingle them as any other patient? Okay, so the next one you need to understand. What role does confrontation play? Now, in the old days, that meant a pretty intense experience and interaction with patients. And treatment centers don't do that anymore. You may hear mention of hot seats or things like that. But believe me, all treatment centers are going to tell you they don't do that kind of confrontation. In social work, we sometimes talk about challenging our clients. And that can be done in a very respectful manner, to question and to help a patient question their basic beliefs or ideas or plans or whatever it may be. And that's absolutely essential to any kind of therapy, challenging or asking your client to take another look at this thing. The relapse process, all patients have their own triggers and their own circumstances that is kind of dangerous for them. And so perhaps in the treatment center you go to, they will have a relapse exercise as part of that treatment. I hope they do. But find out what your program does to address that and how they help patients to identify their personal triggers or relapse potential. Aftercare is what's done literally after, like inpatient treatment or even outpatient treatment. Usually it's a weekly thing, kind of informal and loose and everything. Some people require payment, some don't. But find out what this treatment center does. And finally, outcomes. Hopefully the place you visit does ongoing evaluation after people leave treatment. And by outcome we mean, are we getting the desired effect that we're looking for, the desired changes that we're looking for? But more than that, it's also like, what do you consider to be successful? Is it complete abstinence? Is it just 1 or 2 relapses? Is it what we call harm reduction, where people are not being arrested anymore and they're keeping their job? I mean, even if there's a relapse there, that's positive news, right? I mean, so find out how they define it, what the criteria are, okay? And so once you're done with this, write a summary of your impressions, what you think the strengths and weaknesses are, and whether or not you'd refer a client and all that sort of thing. Keep in mind that the more initiative you show, other than just asking this question and answering it, the more initiative and interest that you show, probably the better off you are. Do me a favor and make sure that you address each question at a time. So just write it out or copy it and paste it so that I know what it is that you're answering and answering in full. So that's the assignment. Again, please try and find other people to go with. Um, and if you have any questions about whether or not it's a legitimate treatment center or what it is that we're looking for, just email me and message me, and I'll get back to you just as soon as I can. And the same holds true if you have any further questions or need any further clarification. Just give me a holler, and we'll get you straightened up and on your way. Okay?